Hi there, my name is Dennis Eldridge. I'm a physical therapist here in Enumclaw. I work at Aspire Physical Therapy, and I've been a physical therapist for about 20 years here in town. Physical therapy is a great profession. A lot of exciting things you get to do in this field, and hope that maybe through this video conference you guys are doing, that you'll find some interest in physical therapy. The training for physical therapy actually is quite a lot. You need to have a doctorate degree in physical therapy. And so normally that requires a bachelor's degree to start with at a four-year institution, and then you would enter into a doctorate of physical therapy program, which is about 3 years. Different schools have some different options on how you can do that. Some allow you to do 3 years of a bachelor degree and then 3 years of the doctorate degree, so you can actually get done in 6 years. Only a certain number of programs throughout the country do that. So anyway, you're looking at least 6 years of school, more likely 7. It's really awesome though, because you get to do and learn about things that are interesting to you, so even though it can seem like a long period of time, it's really rewarding and it's a great profession to get into. Average salary for a physical therapist is about $85,000. Obviously you're going to come out of school with some debts, so you got to put some of that salary toward paying out those debts. But that takes time, and that's something that a lot of people have to face as they get into their careers. The field of physical therapy is pretty broad. I work at a physical therapy clinic that primarily sees orthopedic injuries, which is mostly muscle, bone, joint type injuries. We see people who have had surgery, who've had car accidents, who have had work injuries. It could be anywhere from a neck injury to a shoulder injury, lower back, hips, knees, ankles, feet, hands and wrists, elbows. So pretty much any body part that you can hurt, we can see. People who have had surgery, could be knee replacements or rotator cuff repair of the shoulder, hip surgery, back surgery, just a lot of variation on that. Physical therapy involves a lot of exercise, a lot of stretching, a lot of education to the patients about how to improve their condition. It may include some things about posture and body mechanics, how to move and sit and lift and work in their environment safely. Also includes what we call manual therapy, which is different than massage therapy. It's hands-on techniques that help the person's joints to move better. May include some things that help the connective tissue to move better, to lengthen things. So there is some hands-on techniques that we do. There's also what are called modalities, which are machines that we use, different than like an exercise machine, but an example would be an ultrasound machine or electrical stimulation, and those are used to help promote tissue healing and to reduce pain or muscle spasm or to reduce swelling. Some of you may have experienced some of those before if you've had some sports injuries or other types of injuries. Ultrasound is similar to what you would see in a hospital where they're looking at a pregnant mom looking at the baby or looking at organs, but we don't look at anything with ours. We actually use it for treatment. So it's a different type of ultrasound that helps increase blood flow or reduce inflammation or swelling around a joint or a body part that could benefit from that. We also use electrical stimulation, which can help reduce pain and swelling. It's electrodes that maybe are placed around the knee to help with knee swelling or pain, and that can be real effective for people. So we're not trying to shock anybody, we're just trying to help reduce the sensation of pain and help to flush some of that swelling out of the knee, if that's the area that we use it on. Typically, physical therapists work in an outpatient setting, but they can also work in a hospital setting. They can work in school districts. Enumclaw School District has Mary Holland, who's a physical therapist that works with a lot of kids with special needs, some developmental and physical disabilities. If you're really interested in that part of physical therapy, I'm sure she'd love to have you come observe with her and have some time to spend following her around. Obviously, that's when school gets back in session. Physical therapists also work in nursing homes with older folks, maybe that are having trouble walking or balance. They can work in rehabilitation centers, which is like a skilled nursing facility where someone might be going from a hospital to a rehab center and then finally back to their house. So a lot of different settings that physical therapists work in. You work with a variety of patients from young to old. I've had patients as young as 10 months, which is kind of crazy. Not teaching the baby much, but more teaching the mom some things about how to care for the baby and protect the baby's body. And then as old as 100 years old, older folks that have trouble with walking or balance, and then everybody in between. We see a lot of athletes, a lot of middle-aged people, a lot of young people, students, and it's just a great variety of people to get to work with and very rewarding. So hope you guys have enjoyed this talk, and if you have questions, feel free to email me. I think that'll be included with the information that you're given for this conference, and look forward to maybe seeing you here in the clinic as a volunteer or observer as you pursue your career in physical therapy. Thanks.